Sometimes as a neurosurgeon, you literally have to invent a brand new surgery that's never been done before, and you might be the first person to do it. So one of the hardest areas to get to in the brain is underneath this structure called the pubis ridge and near this opening called the jugular foramen. It's really difficult to get to it through an endonasal approach through the nose because you have eustachian tubes in the way, and you can't really injure those. So Dr. Labib actually invented a way to mobilize the eustachian tubes so that you can get to that part of the skull. So the way that he described the surgery is by taking something called an endoscopic approach, which is where you use a camera to go through the nose. And if you look at this coronal section here, you can see exactly where the instruments would end up. And that is the coronal section. If you were to cut the skull in half like this and look at it from the front, this is what you would be seeing. And through this approach, you would have to identify the Vidian nerve as well as the maxillary nerve. And so to mobilize the eustachian tubes, you have to drill down this bony protuberance called the pterygoid process, at which point you can identify the soft tissue that's holding the eustachian tube to the skull. You then have to drill the pterygoid tubercle in order to identify the pterygoid depression. And we also have to drill through a structure called the scaphoid tubercle in order to get to the medial ovale depression. And these two green lines show you where the incisions are made to mobilize the eustachian tubes. And the view after the ET2 mobilization will show you where the lower cranial nerves will exit the hypoglossal canal as well as the jugular foramen. So the point is, not every patient is built the same, and there is no one right answer for how to approach a specific region of the brain and how to treat a certain pathology. So that's why being a neurosurgeon, there's this huge burden on your shoulders of being able to create the best possible approach for your patient. And if one is not already present, then you have to invent it for yourself.